Morbid obesity. It's one of the biggest health challenges we face today, and it's so much more complicated than just diet and exercise. We're about to get into the really complex science that explains why, for some people, the most powerful solution isn't found on a dinner plate, but in an operating room. And just to get a sense of the scale we're talking about, listen to this. The World Health Organization says that worldwide obesity has almost tripled since 1975. I mean, that's not some slow, gradual trend. That's a global health crisis exploding in just a couple of generations. A spike like that forces you to ask a really basic question. How in the world did we get here? And to even start to find an answer, we have to kind of shift how we think about it. The WHO has actually considered obesity a disease for decades, which means we need to look past just personal choice and dig into the complex biology that's really running the show. And the numbers, they're just mind-boggling. Back in 2016, there were 1.9 billion adults who were classified as overweight, and out of that group, 600 million were living with obesity. We're talking about something that's affecting every single corner of the globe. So, why is it so incredibly hard to fight? Well, because it's not just about willpower. Our own biology is an unbelievably powerful force. Scientists have found specific genes, like the FTO gene, that can create a very real predisposition. Then you layer on top of that our environment, the bacteria living in our gut, and these powerful hormonal signals, like ghrelin, people call it the hunger hormone, that can drive appetite in ways that willpower alone just can't compete with. And when you understand all that biological complexity, you start to see a huge flaw in our usual approach, right? If obesity is a disease that's driven by our genes and hormones, why do we keep treating it like it's just the simple behavioral problem? This is exactly where the typical therapies just hit a wall, especially for people with severe obesity. This quote from the medical literature, it's pretty blunt, but you have to hear it to really get the reality that so many patients are up against. For severe obesity, the traditional medical advice, diet, exercise, lifestyle changes, it has at best limited success in the short term and almost zero success in the long term. And nothing, I mean nothing, shows this gap better than the landmark Swedish obese subject study. After 15 years, a long time, the group that got the conventional medical therapy, they lost on average just 1% of their body weight. But the surgery group, they lost 18%. That is not a small difference. That is a completely different world of an outcome. So what is it about surgery that makes it so profoundly different? Well, it's not just about physically making your stomach smaller so you can't eat as much. That's a really common misconception. The real magic, the real power, is that these surgeries fundamentally rewire the body's chemistry. Okay, so it all starts with a hormone called ghrelin. This is the famous hunger hormone. It's made mostly in the stomach, and its whole job is to send these super powerful, "Hey, I'm hungry" signals straight to your brain. Well, some procedures, like the sleeve gastrectomy, literally remove the part of the stomach that makes most of it. So with less ghrelin, that constant, nagging, driving hunger can just fade away. It's a chemical fix, not just a physical one. Then you've got another set of players called incretins, like GLP-1. These are hormones that your gut releases after you eat, and they tell your pancreas, okay, time to release some insulin. Now here's the wild part. Gastric bypass surgery can cause a massive surge in these hormones, and that is why it is so incredibly good at treating and often completely reversing type 2 diabetes, sometimes before the patient has even lost much weight at all. Let's just walk through how that happens. In a gastric bypass, food gets rerouted. It completely skips the first part of the small intestine. This means that food and nutrients slam into the lower part of the intestine way faster than usual. Well, that part of the intestine is packed with the cells that make these incretins. When they get hit with food so quickly, they release this huge wave of GLP-1, which then kicks the pancreas into gear to boost insulin and get blood sugar under control. It's a pretty brilliant biological hack. Okay, so we get the how, the chemistry behind it, but what are the actual surgeries that are making all this happen? Let's take a quick look at the main types of bariatric surgery. So these procedures all work a little differently. You've got the sleeve gastrectomy, which is both restrictive and hormonal. It shrinks the stomach and takes out the main source of that hunger hormone, ghrelin. Then there's the Roux-en-Y gastric bypass. We call that mixed because it creates a smaller stomach pouch and it reroutes the intestine, which changes how you absorb nutrients and gives you that big incretin boost. And finally, there's an older one, the gastric band, which is purely restrictive. It just uses a band to create a small pouch at the top of the stomach to limit intake. But, and this is a huge but, it is so important to understand that this is not an easy fix. Bariatric surgery is a powerful, life-altering tool, but it is not a cure. It comes with some pretty serious risks, and it demands a lifelong, no excuses commitment to a totally new way of living. And the realities of these surgeries are serious. Right after the operation, patients can face risks like leaks from the staple lines, infections, or even blood clots. And those risks don't just disappear. Long-term, there can be complications like ulcers, hernias, gallstones from losing weight so fast, and yes, even weight regain if those new lifestyle habits aren't followed to the letter. But maybe the single biggest lifelong commitment is managing nutrition. When you permanently alter the digestive system, you permanently change how your body absorbs critical vitamins and minerals. Deficiencies in B12, iron, and calcium are really common and can lead to things like nerve damage and anemia. And a severe lack of thiamine or vitamin B1 can cause a neurological emergency called Wernicke encephalopathy. We're talking severe confusion and potentially irreversible brain damage. This is why taking supplements and getting monitored by doctors for the rest of your life is completely non-negotiable. So, all of this brings us to one final question. We've seen the data, we've seen how it works, and we've seen the risks. Is bariatric surgery really a cure for obesity? Or is it more accurate to call it the most powerful tool we currently have in a much bigger, much more complicated fight against a really powerful disease? The real answer is probably somewhere in the middle, and it reminds us that for a condition this complex, the solutions have to be just as complex too.